Okay. Greetings, everyone. Greetings, panelists and participants. My name is Edwin Seonda, the Digital Coordinator and Partnership Associate at Africa Health Business. I would like to formally welcome you to the virtual official side event on the sidelines of CPHIA 2023 happening in Lusaka, in Zambia. This side event is organized by Africa Health Business in collaboration with Gravitate-Health, themed Empowering Patients Through Digital Health Information for Public Health in Africa. To start off, I'd like to highlight some guidelines for this session. Attendees will be on mute during this session. This session will be live streamed on AHB's YouTube's account. This session will, of course, be in English and will last for approximately 2 hours. Feel free to post your questions in the Q&A sections at any time. During this session, we'll be responding to them as much as possible. The main key objectives of these sessions include: we aim to nurture commitments towards increasing investments of public health in Africa, with a really specific focus on digital health solutions. The second one is we aim to ensure that all participants in this session will leave this session with a great understanding of how to utilize digital tools. And our final one, the one important one, is to bridge the gap between healthcare infrastructure and patient empowerment. To quickly highlight the session agenda, we'll have five panelists. Our moderator will come from Africa Health Business and 4 particular experts from across the world. One is from Gravitate-Health, Africa CDC, the Global Fund, and Capsule. Thereafter, we'll have a brief Q&A session and parting shots. We will have a Q&A session following the questions that we'll be posting during the sessions, following by our parting shots from all our panelists, and I'll finally conclude the session. As of now, I'd like to introduce the moderator, Dr. Daniela Munene. She's an enthusiastic pharmacist, professional with 17 years of experience in skills and strategic planning, business development, policy analysis, team leadership, and management of key stakeholder relationships in health. Currently, as the head of external affairs at Africa Health Business, she has a strong passion for equitable healthcare for all, in actively involving in policy recommendation and idea mobilization across the health sector towards attainment of the universal health coverage. Thank you, and I'm welcoming Dr. Daniela Munene.
Thank you, Edwin, and I'd like to welcome all participants on this call. I recognize some people. You're all welcome, and I also want to welcome our distinguished panelists. I want us first to remember that the theme of CPHIA is breaking barriers to reposition Africa in the global health architecture. And I think that digital health is part of that repositioning so that we're able to better serve our 1.4 billion population. So the components of digital health, we know them: electronic health records, telemedicine, mobile health, health information systems, health information exchange, data security and privacy, very high level summary. We want to explore all these aspects and see what the impact can be to empower the patient to have a more impactful healthcare journey. We have challenges of infrastructure, limited resources, lack of standardization, data security and privacy concerns, data quality and accuracy. We even have cultural and ethical challenges as we try and roll out digital health components and applications. But we do have opportunities to build our health workforce, to capacity build even the patient. We have research and innovation opportunities, and all this rises and falls with partnerships. However, I want us today to focus on the impact on patients. Amongst other impacts that digital health can have, such as efficient healthcare systems, data-driven decision-making, empowering health workers, let us look at how digital health can empower patients to have increased agency over their healthcare journey by giving them the right tools, information, and resources that they need. Now, after setting this stage, I want to talk about trends and future outlook of digital health. Amongst the many directions that digital health is going into globally and in Africa, such as innovation hubs, e-health platforms, improved interoperability, I want us to focus on patient empowerment and engagement. As a trend, where access to personal health records, health education resources, and tools for self-monitoring will contribute to improved health outcomes. Let us not forget the patient. In fact, digital health gives the patient an opportunity to be front and center of development of health systems. Let us not forget why we are all here. It is for the patient. With those few remarks, we have lined up for you very distinguished panelists this morning, experts in their field who will help to unravel this message of empowering patients through digital health information to further public health in Africa. Our first panelist is Dr. Jean-Philbert Nsengimana, who is the Chief Digital Advisor at the Africa CDC. Previously, Philbert was the Managing Director of the Commons Project, and he has served on many boards, including the Alliance for Affordable Internet, where he's the honorary chairperson, and in the Place Fund, in I4Policy, in Startup Genome, and Future State, a very digital person indeed. Dr. Philbert holds a master's degree in public administration from the Harvard Kennedy School of Government and a global MBA in information technology, a master's degree in software engineering, and a bachelor's degree in computer science. I will introduce our second speaker, who will be Mr. Robert Cryer. He is the Country Technology Services Manager at the Global Fund. After 25 years in the international chemicals industry, Robert moved to global health, and we're glad he did. Initially, he was the head of IT at Gavi, the Vaccine Alliance, before moving to the Global Fund. At the Global Fund, Robert has been responsible for putting together the Global Fund's e-commerce platform, Wambo, with a current turnover of in excess of $2 billion, before managing the grant operation system platform, which disburses $5 billion annually. More recently, Robert led the newly formed Country Technical Services team, focused on delivering the most impact in the countries that the Global Fund supports with their digital health investments. Currently, the Global Fund, it would be interesting for you to know, through its grant mechanisms, invests over $100 million per annum in digital health. And we're so glad to have Rob Cryer with us today. Our third speaker for the day will be Mr. David Chen. He's a co-chief executive officer at Capsule. He's a visionary leader and co-founder, a pioneering African healthcare data analytics company, Capsule. With a background in genetics and over 6 years of pharmaceutical consulting experience, David is helping Capsule to revolutionize African healthcare by collecting, aggregating, and standardizing data from various markets. This enables clients to gain invaluable insights for optimal business operations, uncover commercial opportunities, and enhance clinical development across the continent. Our fourth speaker for this webinar will be Dr. Anne Moen. She's a professor in health informatics and nursing at the Faculty of Medicine at the University of Oslo. She's also the coordinator of a project called Gravitate-Health that she'll tell us more about in this webinar. Professor Moen has been the president of the European Federation for Medical Informatics, amongst other roles. And currently at the university, she has worked on EHRs and citizen-centered services with emphasis on feasibility and usefulness for vulnerable groups and the elderly. She has extensive interdisciplinary and academic leadership experiences at both international and national levels. Professor Moen is the coordinator of the Gravitate-Health project, where her role is to co-lead the work, encourage and motivate partners, ensuring the project is aligned with the mission and purpose. Being the main interface to IMI is part of her role, and she'll tell us more about that today. So that's the panel of experts we have for you today. And I encourage you to, as the panelists speak, to ask your questions on the Q&A tab, and I will do my best to address them to the panelists at the end of the presentations. For now, I'd like to welcome Dr. Jean-Philbert Nsengimana to give us an overview of the Africa Digital Health Network and make some comments about how this great new exciting initiative can end up being of benefit to patients in Africa. Over to you, Dr. Philbert.
Thank you, Dr. Daniela, and good morning, good afternoon, everyone, depending on where you are. Thanks for having me here and talk about something that I'm really deeply excited about, which is the Africa Digital Health Networks. In Africa, we believe in this wisdom that if you want to go far, if you want to go fast, you go alone, but if you want to go far, you go together. And this initiative aims at bringing the communities of practice in digital health together. And this is based on the fact that we all know that one of the biggest constraints that we have in developing our public health is the scarcity of the human resources. Is the fact that in Africa, you count one doctor for about 4,000 people, while in the rest of the world, you count one doctor for, let's say, 250 people in Europe, 400 in the US, in Cuba, it's 180. And we need really to find a way to leverage technology to create a multiplier effect on the few qualified human resources that we have. And I think putting the patient at the center, as Daniela, you want us to really focus on that. The question is, how do you empower, enable, and connect the health workforce that we have to reach that massive customer base? So we said one of the ways to leverage that community is to bring them together, to connect them, and exchange and learn from each other. So we started this initiative a couple of months ago in the partnership with the Africa Health Business. So thank you so much, Daniela, for the personal role you've played in this, Dr. Amit and others at AHB, with colleagues at PATH, but many other Pan-African and global stakeholder organizations, including some of those on this panel. So thanks, Rob, also for the Global Fund for being part of this movement. And then for those who were able to join, we unveiled this initiative in Kigali during the last Africa Health Tech Summit. So we are still in formation stage. So those who want to join us as founding member, we still are calling for founding members. We are already at about 200 individuals, experts, and organizations who want to be founding members of this organization, which is going to be an umbrella organization for digital health communities of practice and experts. So we are calling on technical communities of practice. We know that there are very strong and large communities around health information exchange, for example, telemedicine, DHIS2, for those who know what this stands for. And I think my colleague from the University of Oslo may be smiling, because this is a technology that is present in almost every country in Africa, helping ministries of health manage health information systems. But there are strong communities around open HIE. So we want to bring those communities together because we know there are few of them and we want to expose them to the opportunities that are available. The national e-health agencies, national associations and digital health working groups, they are almost in every country. We want to bring them together to strengthen them. We've got a large and growing health tech startup community, investors, vendors. We want to know who they are, what are the solutions. And one of the biggest objectives we have as ADHN is to provide a platform that will allow for scaling and sustaining health tech innovations. I think Africa has no shortage of health tech innovations, but many of them have stayed at pilot stage at very limited scale. And we want to say, hey, here is the demand side. Because the supply side, led by governments, is really ahead of the demand. So we want to really look at what is there that is preventing the demand from catching up from the supply, and for the market to be much more effective. And then we have development partners, not-for-profits, civil society organizations that are investing, using, and promoting digital health solutions. We're also calling on health tech providers that use digital health tools in their daily lives, from the doctors in super specialized facilities to community health workers. And then we are also bringing on the academia and research institutions who are to advance digital health. So we have a few objectives. The first and most important, we want really to strengthen digital health capacity across this continent, contribute to the training of 100,000 community frontline health workers by 2030, accelerate the adoption of digital health technologies such as mobile health apps, telemedicine, connected diagnostics, electronic health records, and so on. We are going to be promoting digital public infrastructure approaches and open standards to advance interoperability for a person-centered care and data use for decision-making. We're going to be creating convenings, training, knowledge-sharing platforms to strengthen the capacity of our communities of practice. We're going to be advocating for policies that accelerate digital health maturity in our member states in Africa. And then we will also identify, support, and promote the adoption initiative that's advance health security on the continent. So we really have very high hopes and expectations, and we look forward to bring together those stakeholders under one network to improve coordination, donor alignment, sharing of best practices, advocate for increased digital health investments, and enable partnerships that are going to help scale digital health adoption on our continent. So let me pause here and really say we are so honored to be part of the Conference on Public Health in Africa. Thanks, AHB, for having us. For those who are going to be able to make it in Lusaka next week, I'll be there. Many of us will be there. AHB will be there. Please say hi, and let's continue this journey and revolutionize healthcare on the continent using technology. Thank you.
Thank you so much, Philbert, for that overview of the Africa Digital Health Network. Participants, if you want to know more about ADHN, you can click the link that I've put on the chat. And I do see Cyril Sek on the call as well. Welcome. He's also heavily involved in ADHN. Cyril, please do post any updates you wish participants to know regarding ADHN. What I know is that you're all welcome to join ADHN either as an organization or as an individual. Be part of the network of learning and practice. So thank you so much, Philbert. We will circle back to you with some questions from the participants. All right. Now, we want to talk about advances in health management information systems in Africa. And for this topic, I'd like to welcome Mr. Robert Cryer from the Global Fund to give us his remarks and to tell us how this, can these developments that are happening in HMISs can benefit the patient. Over to you, Rob.
Thank you very much, and thank you for the invite. It's a very great pleasure to be here today. So what I'd like to do, if we could just go to the next slide, please. So the question that we wanted to look at and to pose here is really to ask ourselves: are the health management information systems providing traceable patient data that can be used to feed back that information to the patient? Are we there yet? And it's true to say it's a journey. And I think in order to be able to answer the question, I think we have to look at it from two perspectives. The first one is there are over 50 countries in Africa, and they are all at different levels of maturity. They're all at different places in that journey, and so you can't answer this with a with a yes/no question, nor would you expect to. The other thing, just to broaden it out, is quite often when you hear people refer to HMIS, they very often think of DHIS2 as being the reporting, the sort of key reporting tool that's been adopted by the majority of countries as being the health management information system. But I think we need to look at it. Actually, we need to think about the broader context here. And you just heard a moment ago from Phil talking about in telemedicine and the sort of the infrastructure. There's a whole raft of other capabilities that are required in order to be able to get that infrastructure, to get that information back to the patient. And I think, and this is where like the Global Fund will hold up its hand a little bit and say, we have been focused very much on reporting. We're a donor organization, and we need to be able to explain to our donors that the money that's being granted is being well spent, and this has driven a lot around the programmatic frameworks and the ability to report back that things are moving in the right direction. And that has really led to this sort of top-down approach that we have, and that's why I somewhat like the picture on the right-hand side, is that we've done a very good job. DHIS2 is a very good and powerful tool at aggregating the data, but at the moment, is it really fed from a strong foundation? And also, when we look at that, without that foundation, then it brings into question as to how do we get the information back down to the patient, back down to the clinician, which is really the sort of the core of the question here. I think what it's highlighting is that there's an area that is underinvested in right now, and this is the area where I think we need to focus some more in order to be able to get the data back down to the patient. And I like to quote at this point a Tanzanian doctor. I love this quote where he said, "The data defies gravity. It goes up, it never comes down," and that really is a problem here. And it's at the core of what we're saying is how do we get the information back to the patients? And we really now have to start to think about, and we see in many instances, people are already very much on this journey and are deploying both an electronic medical record system for a clinic, but also community health information systems. These are the core tools for grabbing the data at source, and this I think is a key part of improving data quality, improving the information, and also being able to give that feedback. So why particularly an electronic medical record? So what you want to be able to do here is to give the clinician that longitudinal view. Can we see the entire history of the patient? And also not just, as we've, again, Global Fund holding its hand up here, is not just the HIV report, not just the TB report, but looking at the patient and in the round as a, in the context of everything else that is going on with them and their health. So not just about that specific disease, but do they have diabetes? Are they hypertensive? Are they pregnant? There's a whole raft of other pieces of key critical clinical data that you really want to bring together into a single electronic medical record, doctor, so the clinician is best informed in their ability to treat the patient, and it does really promote that patient focus. The other thing that you get with the electronic medical record, if you start to use you build the right ecosystem, excuse me, you are then also going to be able to bring in the patient lab results. You can be able to bring in the pharmaceutical, the dispensary information, not just today, but the history of that information. You can bring in finance information that very much enriches the overall picture. And so with that, you really are trying to view not just the information from this particular clinic, but from any clinic that the patient has visited in their life. And so with all that, that's the sort of infrastructure and sort of systems that we need to start putting in place in order to get the best outcome from the patient and to be able to answer this question, are we able to use the HMAS data? And for me, the answer is definitely yes, we can. But are we doing that right now? So if we go on to the next slide, so I think the answer is yes. Some countries are doing this, and they're doing this. They're doing this pretty well. There's other countries that are just starting out on this journey. And obviously there are some that have yet to commence. What are the sort of key challenges that we've been seeing when we look at this? One of the big issues that that really blocks the use of digital technology is that top point there, and that's power and connectivity. So 25% of clinics in sub-Saharan Africa do not have electricity, and a third of them do not have reliable power. And it might sound a bit trite, but digital doesn't work without power. We really need to invest and look at the infrastructure. The second part of that is connectivity. Power is obviously a key enabler. Connectivity multiplies that 1,000-fold in terms of what you can do with the data and with the clinics. And I'm not necessarily just thinking here about the clinical data about the patient, but there are the ability to train people, the ability to do telemedicine. There are so many other benefits that you get from that connectivity that that comes when we can solve these problems. The next one is just to talk about the unique patient ID. This is one of the key registries that we need. I'll talk about registries in a moment. You need to be able to have that unique ID to be able to link together the patient from whichever clinic they visited, from whichever dispensary they received their drugs, from whichever lab the samples were tested. The unique patient ID is the key thing that links them all together, and so it really has to be a focus on getting that in place as one of the key initial building blocks. The other thing that we see is around capacity building. And again, Phil mentioned this earlier in terms of the ratios of clinicians to patients. You then add on top of that, you want to bring in a new tool, you want to bring in some digital technology that they need to be trained in. But also we need to think about this. We often use the term capacity building almost in a throwaway term. Let's say, yes, we know we have to do capacity building, but it's worth drilling down a little bit into saying specifically, where do we need to do that that capacity? I mentioned the obvious one when you're deploying software is that you need to train the users in the benefits they can derive and how to use the software. But also don't lose sight of the fact that this, again, if we're putting in connectivity, power, and we're putting in new software, there's a whole technical support process that needs to be developed. We need people that are capable of managing communication technology. We need people just to run the help desk around these tools. So it is at very many levels, and I've also put in there at government as well. One of the biggest enablers of us being able to do this is good governance and a strong drive from the government. And if they understand and they see the benefits, then again it really takes the brakes off. I've actually put in change management. Often people, when we think about capacity building, they think of capacity building and change management as being very similar. Not saying that. I just wanted to call this out is again, if you want to go from a paper-based system to an electronic-based system, there's a lot of trust that you have to build up in the new electronic services. People have to get familiar with the new way of working, it's often very difficult to let go of what you know. And so underinvesting in change management, again, is something that we see as a challenge and holds back the deployment and the implementation of these projects. So just finally, so some key enablers. As I mentioned, it's that strong governance and clarity of purpose. That has a really big impact on our ability to move forward. Alignment to standards, and I'm picking out particularly things like HL7 fire as a particularly powerful standard, but there are others in there which allows the interoperability of information, and not just nationally, but across borders as well. There's some very powerful standards that we want to use. Registries, again, we talk about the unique patient ID, that's right, but don't forget, we also need to have good, strong registries about where are all the clinics and what are their capabilities, what services are provided at those clinics, and also of the health workers, be it a community health worker all the way up to a consultant surgeon. What are their capabilities? What services do they offer? Where are they? All of this needs to be as built in as part of the foundations, the building blocks of getting these systems running, so we can provide the best services and therefore get the best outcome from the patient. And a lot of that sounds quite daunting, but there are some really good global goods out there. So these are systems that have been deployed in multiple instances. They've been tried and tested, and somebody else has done the debugging for you. And these tend to the lower risk. They tend to have nothing is free of bugs, but they are lower risk. They are faster to implement. They tend to be more configurable than building it yourself. Because this is one of the other things that we often see is people wish to build their own solution. And I would always urge that you go and check out the global goods first before you go down that route, because this could speed you up and take a lot of the risk out of deploying a new solution. So thank you. That's for me, what I'd like to be able to do is, if we can do this, then the answer to the question is yes, we can give the patient and the clinician the information they need to get the best outcome for the patient. Thank you.
Thanks, Rob, for those insights. A number of questions come to mind, which I will ask at the end of the presentations. But in keeping with safeguarding the patient and improving the journey of the patient, I'd like to bring in our next speaker, David Chen, to talk about vaccine safety. Vaccine safety obviously is a concern, has been a concern for many years, but it has never come to the forefront as much as it did during the COVID-19 pandemic and the ensuing massive global vaccination campaign. I don't know whether it was because it was an adult vaccination campaign initially, that the adults thought, oh, wait a minute, are these vaccines safe? And they forgot that we've been vaccinating babies, for years without fussing about so much about safety. But it's a good development that COVID vaccines brought the issues of safety to the fore. And so I'd invite you, David, to just tell us how digital solutions can assure the safety of patients who are taking vaccines, something that's so important with COVID vaccine and all vaccines.
Firstly, thank you for having me. It's a real pleasure to be here. And yes, the introduction you gave there was very, very pertinent in the world today. We've all changed since COVID has happened. It's really taken public health and vaccinations into the public consciousness in a really strong way. And why vaccines in particular are important as an indicator for public health is not just because of the press or because of the attention that was paid to particular diseases, but it's a very unique use case because with vaccinations, they require a higher level of sophistication in terms of their handling and treatment, because they are temperature-controlled products, which can degrade if they're not kept in very particular conditions. So in the case of COVID, it needed ultra freezing in minus 80 degrees plus typically. And secondly is because they're applied in healthy populations. Normally, when we think about medication or treatment, it's usually in a case of getting someone who's already sick back into a state of health. But with vaccinations, it's applied to healthy populations where the benefit isn't just on the person being vaccinated in reducing their risk of developing the disease. It also has an effect on preventing the potential spread of the disease to others. So really has a benefit outside of the individual themselves. And finally, vaccination is a place where a lot of the digital solutions is applied because it's one of those novel disease categories or novel treatment categories. So a lot of the work that's been done by institutions when it comes to digitizing the monitoring, the reporting, and the optimizing of the process is actually done in the vaccine industry. But I'll also take a slightly different lens as well as a healthcare innovator. I live and breathe digitization of healthcare every day. And one of the things that I also notice is that it can become quite a confusing space where there is a level of hype that can actually drive confusion and misunderstanding on what digital solutions actually do. So my objective behind this talk is in three parts. The first one is actually to demystify a lot of the digital solutions while giving, secondly, some insights into the real world applications of digital approaches, which we'll talk about some use cases in the vaccine space. And then finally, just give you a slightly different toolkit on how to think about digital solutions so that when you go back to your organizations, you can actually ask the right questions and identify what solutions are actually applicable to you in your specific use case. But I'll open by saying that with the digital solutions as a whole, they fall into three categories: either monitoring, reporting, or optimization. And why that's important is because those three pillars form the feedback loop, which can allow for things to improve over time. And many of the solutions that were mentioned earlier by both Robert and Jean Vilbert is a lot in particular around DHIS2, which is a very good starting point of actually monitoring what's happening in the individual in the individual countries and the individual health systems. And there's a lot of work that is now happening with the building of health information exchanges or health management information systems that are being in play to move it from not just monitoring to reporting as well. So how do you take the raw information about what is happening on the ground and then turn that into information so that you can interpret what is happening? And then the final piece is around optimization, which again, to Robert's point, spoke to the implementation of EHR software or increasing capacity at a facility level, whether it's power or connectivity or things like that. These are the things which are implemented, which ends up enabling the first two steps of monitoring and then reporting. So you really have to think about healthcare technology in that ecosystem and then really identify which of the three you're actually trying to optimize for or trying to improve. So to take things back to vaccines a little bit. So I did allude to earlier the importance of monitoring the conditions of the vaccines and making sure that they're kept in the right conditions so that when they're dispensed or injected in someone's arm, it's actually at the right level of quality. And there's been a lot of work done by many different institutions, not just here at Capsule, but also many across the ecosystem in many African countries, which are doing things such as real-time monitoring of product conditions, so telemetric data around temperature, humidity, exposure to light or shock, or anything that could really compromise the integrity of the product, in addition to providing some supply chain reporting information. And what we've seen is that clients particularly like this because that actually helps them know if there's any excursions that happen on the way, or if and the overall efficiency of a particular supply chain of getting the products from being sent from the manufacturing to the point where it's dispensing it to someone. And seeing how much loss is incurred along the way due to damage or wastage along the way. And a lot of the clients particularly request real-time data. And that's one of the things that I want to demystify as well, because while real-time data sounds amazing, to know instantly what happens when it happens, that is great on paper and conceptually. But from the organization's point of view, what I also mention is that you also need to monitor your response time. So from receiving the information or notification that something is happening, how quickly can your organization actually respond to that information? There's no point being able to be told within 5 minutes that the temperature, which is the refrigeration, which is handling the vaccines, has had an excursion in temperature, and you can't respond for 3 or 4 days. Then the information arriving to you 12 or 12 or the following day, it doesn't really make any difference. So what I talk to organizations about oftentimes is really drilling into their process that lies behind the data, and then see how that data can actually inform the information or inform their actions and decisions from there. In addition to the vaccine safety, there's a lot of that is also being done in terms of the monitoring and reporting and improving of the vaccination programs in and of itself. So I do a lot of work in Capsule when it comes to aggregating data from many different sources, with the similar objectives to the likes of DHIS2, but predominantly in the private sector. And what we've noticed is that there are many different institutions that are doing great work when it comes to screening and prevention and awareness around particular diseases. And to give an example, cervical cancer is one very important area where the HPV vaccine has been great in preventing the development of cervical cancer. And what I've noticed is that it's the combination of people and the processes which are really driving the improvement of the vaccination programs, because it's helping the patient not only understand what is the treatment and the treatment pathway, and how the vaccine improves their safety, but then also it helps the actual delivery of the vaccine through some of these programs. Now, my next point is particularly on addressing the challenges and barriers related to vaccines in Africa, and how digital solutions can mitigate these challenges. So what we really need to focus on is the ability to capture the information and then monitor who is receiving these vaccines and who is being left behind, because that is an area that is required to know where to target your efforts in future. So there has been a lot of great work that has been done by the likes of Gavi or the Sabin Vaccine Institute when it comes to creating repositories of immunization. And those things work incredibly well, particularly in the public sector setting, and through highlighting areas where increased focus and attention is needed. And due to some of the things that was mentioned by Rob, due to the adoption of interoperability standards, is actually making that information a lot more accessible to the private sector as well, by being able to plug in and utilize some of that data. So what the real world impact of that means is that when you have commercial institutions that are actually producing the medicines and they're seeing that there's hotspots of particular diseases, let's say the cervical cancer instance, that actually gives them the equipment to go back to their organizations and do things which can increase medicine access and medicine access drives. So by actually capturing the data, making it really easily usable, accessible, to not only public institutions, but also to private institutions, you can have a company reduce the price of said treatment so that it can actually reach a wider net of people. And these are in cases where the patients that it's reaching may not be able to afford the treatment out of pocket, or where the government programs are quite limited in terms of the reach that it can get. So there's real world applications of using this data. And I think what we really need to think about is having a collaborative approach across the silos, whether it be the private sector or the public sector, and finding ways to connect them to really understand what is happening on the ground and how we can target particular areas that have the biggest impact. So I guess what I will say in closing is that what is super encouraging to me as an innovator on the continent, I'm based out in Kigali, but I do a lot of work in many African countries, is that there is a clear drive towards making data more interoperable, making data more usable, and being able to have that feedback loop that I alluded to earlier. So first monitoring, and then reporting, and then optimizing. And through that process, we will have an overall improvement of the health system and be able to target specific areas which could be vaccine related, or they could be related to other diseases, and have that real evidence-based decisions as part of the process of managing the health systems here in Africa. So I'll close with the final remark, where this is actually to quote from from the president of IQVIA, who actually spoke at a Africa Health Data Summit a few weeks ago, where he mentioned that Africa has a potential to leapfrog many of the developed countries in the global north because of the adoption of digital solutions on the continent. And when we look to disease categories like vaccines or other programs which are utilizing the latest digital solutions, and making sure that they're having it in an iterative way that improves the overall system by first improving the monitoring, then the reporting, then the optimizing, feeding back into better monitoring, reporting and optimizing. That will set the groundwork and the foundations to a health system that works for all on the continent.
I like your emphasis on feedback, which Rob also made. And aren't patients so well placed to provide that feedback with vaccines, especially reporting adverse events? So in terms of reporting, if we're not getting this critical feedback from patients about their safety, then we're just health workers and health managers talking to ourselves. So those are some of the questions coming to mind that I'll frame to you later, David. So please stay on the line. Let me segue to Anne, who is going to talk to us about addressing systemic/institutional justice from a personal and public health perspective. And as Anne comes, I'll remind participants to ask their questions on the Q&A. Tell us who you are and the panelists that you're addressing your question to. And I will do my best to address your questions at the end of the presentations. Over to you, Anne. Please give us your perspectives.
Thank you. Thank you for inviting me and inviting Gravitate-Health project to present and to discuss with you in this very important event. We are delighted to have Africa Health Business as one of our collaborating organizations. Gravitate-Health is about empowering and equipping Europeans, but I think we can crossmark and say citizens or patients with health information for active personal health management and adherence to treatment. We know that adherence to treatment is a huge challenge, and the speakers before me have pointed out important dimensions in that regard. Safety of information, access to and understanding that things are followed up, etc. I will also address and allude to more to personal health perspectives, but efforts at the systemic level to see how we can make knowledge available to all in easy and understandable ways. Allow me first to share that we are a huge consortium. We're a public-private partnership, and I think that is also an example of what we can achieve going together, as Dr. Filbert mentioned early on in this webinar. I am the coordinator representing University of Oslo, and I'm co-leading this project with Dr. Giovanna Ferrari, who I saw from Pfizer, who I also saw is on the call. And I also see that we have other esteemed colleagues with us. We are about halfway in our project and our program, and collaborating with Africa Health Business is a powerful outreach strategy for us to learn from and interact with different stakeholders globally. So Gravitate-Health in a nutshell is about equipping and empowering patients to use health information for specific self-management, active support during active treatment, as well as for self-care. I think vaccines is a prime example of self-care activities. Allow me to introduce you to one of our ambassadors. It's Maria, and you can see the tools that she has. Maria lives in Norway. She's still use a paper-based medication list. She maintains it on her PC, but the national infrastructure has improved so that now she can also get it digital through the personal health portal. She also uses a lot of medications and have these 1 meter square or larger sheets of paper with product information, which is a key knowledge resource for us. So with those perspectives, what we're trying to achieve is to research how we can apply an open access digital platform with trusted digital health information to transform how patients access and understand health information, and then stimulate how to apply it in personal health for adherence to treatment, risk minimization, and quality of life. We are working with key knowledge resources. The regulator approved electronic product information. That's for short, the paper in the pack. It's also this 1 meter square, usually larger, sometimes smaller, printed paper that comes with medication when it's dispensed. There is ongoing work to make this digital, and that's a huge opportunity for us. It would also be an opportunity for the colleagues in the Global South. We work with information from electronic health records to make sure that this information, or give an attempt actually, to make this information more relevant in a person's health journey, and are adding in other health education material from trusted sources. We put a lot of emphasis on trusted sources. We are also a key delivery of our project will be a federated open source platform with GLANS services, and we have a conceptualization of GLANS, which is a focusing mechanism where we take small subset of personal information, as much as the user wants to disclose, and outcomes, therapy, personality, access to care, etc., into consideration. What we will deliver in addition to this open source platform with these focusing mechanisms and a library of those is a white paper on strategies for future use of this information to make sure that people can take the work a step further. We will also do pilot studies, evaluations, and we're looking for sustainable impacts. So what we've done in Gravitate-Health is to develop a set of personas, since we are a huge community of interested parties from public and private sector. We have to have some shared representations. For us, personas focusing on key aspects for empowerment, for health beliefs, for health literacy and preferred engagement levels has been a very useful tool, and they are the ones that we have developed are all available in the public domain for future use for and future further development. We have created some mock-ups to illustrate what we can try to make better compared to this text-intensive sheet of paper with small prints. We can add in different modalities, picture of the pill, what the medication looks like, if it's an injectable, if it's a pen, and those things. And we've used that to illustrate the concepts. We have used resources in Europe to illustrate access to cross-border product information. Africa, I know, has many languages. We also have a few, but only a few compared to you. But having access to information in a language of choice is a key aspect of institutional systemic justice. It's also a key aspect of making good choices. And so we have added that into our use cases. We have also had some prototypes on focusing information in the product information with the anticipation, given the information we have, the user have disclosed, suggesting that some pieces of this 1 meter square paper-based now digital electronic product information may be more relevant for you. For example, allergies. For example, other medications. For example, if people are older like me, the time for breastfeeding and pregnancy is over. So for me, it could be a possibility just to sort of tone down this piece of information to give a better and more focused experience. We have also been instrumental in working with interoperability resources and have in this project led the work to create one of the FHIA resources that we need. That is the FHIA EPI implementation guide, has been balloted and is now available for public use. We're also extensively using FHIA resources in our setup. Let me see. So we have also recently released our minimal viable product number 2, and that has the following features. It has the medication list. That's the prescribed medication a patient has. We have taken elements or definitions and pieces from the International Patient Summary, which is has a strong emphasis on having a subset of key information that's available to the user. We have illustrated focused leaflets, and we have also search capabilities within the leaflets. And we can do things in terms of access for all, setting, change language, dark mode, change font size, etc. If you're interested and curious, reach out to our ecosystem manager, Robin Freiheit with ECH Alliance, and also Africa Health Business to give us to express your interest, and we will get back to you. This is examples of screenshots in our MVP2. It has information about a specific drug. We have made it easier to navigate in the leaflet. We are applying lenses so that you can ask for specific pieces of information and have that highlighted. And we also have the implemented opportunity to search for words within the leaflet. Going forward, Gravitate-Health is about access, safety, and giving a contribution to drive adherence. So we have a few key areas that we will progress. Multilingual focused information. It looks easy on the slide, but it is an important and also complex problem. We take the medication list as given and start from the e-dispensation. And I think one of the things that we would like to say and promote is that there should not be any dispensation without information from trusted sources about the drug or about the remedy that you are dispensed. This will improve access and understanding, and we anticipate the risk minimization and, of course, patient safety. We need international standards. I was glad to see the emphasis also from the Global Fund on that. So this is a snapshot from elements of the EPI, the Electronic Product Information Implementation Guide and Focus. We are also working with ISO IDMP, which is a unique identification of medicinal products globally, to make sure that we have a robust version. And we will position outputs from Gravitate-Health to support cross-border mobility, also mobility within a country, but we start in Europe, and cross-border mobility in Europe is picking up again, and we have specific opportunities there where we can deploy. We can also innovate and use with our demonstrate and have sustainable outputs that we can deploy and stimulate innovation. In terms of going forward and in terms of epistemic injustice or mitigating for lack of access, lack of equitable access, fair access for individuals, we are thinking along the lines and conceptualizing this notion of smart information. That is information that's safe, suitable, sustainable. It's meaningful and motivating for the user. It's available, it's accountable and accessible, relevant, reliable, and it sticks. And it's transparent, and for this, all of this, we need a team effort. This goes for both the individual personal health level, but also at the level of the systems, the organizations, at the level of public health. And we believe that offering tools like we are working on in Gravitate-Health can make a contribution to stimulate systemic justice, making sure that information is available, it's safe, it's of high quality, and it is helping us as individuals to make good choices in personal health. If you want, and we were allowed by the organizers also to say what are some of the next steps. We are hosting a hackathon in January. It's a hybrid event, physical in Athens and digital, where we are inviting and put up the overall challenge of designing patient information for the future. If you're interested, register at the website. You don't have to be a techie. We need to learn as much as possible and to be able to have as robust solutions as possible, but also to stimulate growth, to stimulate that providing information from trusted sources to patients and their significant others contribute to and remain as a public good. So on that note, thank you for your attention. You can follow us in social media. You can visit our website, or you can contact us at contact@Gravitate-Health. We're also issuing regularly 2 to 3 newsletters of our most recent advancements every year. So on that note, I will hand it back to you, Dr. Daniela, and I will stop sharing.
Okay. Thank you very much, Anne, for that overview of Gravitate-Health. The Africa Health business is very passionate about driving private sector participation in health systems in Africa. And the private sector is really dominating in bringing digital solutions to our health system. And the reason that we are so glad to have Gravitate on board, and this is what we do in all our forums, we bring people who have experienced the same challenges from all over the world, such as this Gravitate project that's being rolled out in the EU. There's something we can learn in Africa, and possibly some shortcuts that we can go through to achieve what you're achieving in a shorter time. So really, thank you for being there. It's all about building a community of learning and practice. And I have seen a lot of regulators in Africa now starting to roll out a requirement for EPILs, electronic patient information leaflets, as part of their market authorization. And no doubt, Africa having 54 countries, we're going to run into the same issues, or we have so many languages within a country, across the continent, and what can we learn from this project? So we want to keep a close ear and eye on what you're doing with your team. And thank you so much.
Thank you, and thank you for this unique opportunity for us. Also, it's likewise, we really enjoy the collaboration.
Thank you. So participants, I see the questions are streaming in. We're now in this exciting forum where you get to ask your question to the panelists. Maybe I want to start with David. I saw a question here from Jacodia in Namibia, where she feels, you can look at it, and the other panelists are free to chime in. She feels we're always we're sort of burdening the health worker always to collect more data because we feel like there's no data. But Jacodia here is suggesting perhaps the data is there, but what's the issue? What's the issue to address, and how can we address challenges related to data in Africa? What does our data future look like? So please, David, start, and perhaps the other panelists can chime in as well.
Thank you for that question, Jacodia. That is a question that's very close to my heart, and one of the things that Capsule was created to solve. And you're completely right, where the perception is that there is no data, so the healthcare worker is burdened with the responsibility of capturing a bunch of information which oftentimes isn't related to delivering care to the patient that they're speaking to. And what we've noticed is that the data does exist on the continent. It's just in different silos. Whether they be different NGOs which are focusing on different programs, you would have one system capturing malaria data, another one capturing tuberculosis data, et cetera, et cetera. You also have the private sector where you'll have health insurers, you'll have the government insurance schemes, and then you also have some other players such as pharmacies or hospitals, all capturing their own data about the patient. What we realized with Capsule, and this is actually realized in both the public sector setting and the private sector setting, but I'll speak strictly to the private sector because that's the area that I'm most experienced and where we focus, is that the challenge is really when it comes to unifying and harmonizing the data. So just a brief insight into what we do at Capsule. A lot of that actual hard work of taking in data, standardizing it, and then aggregating it with other forms of data is what we do. That's our bread and butter. But the whole focus and emphasis on standards, whether it be HL7, CPHIA, ICD-10 codes, etc., that is to get around this problem, where you can have information from one system be pulled or pushed to another system. And the good thing is that this is a problem that has been identified and is actively being addressed at an African Union level, at individual country level, and the work is being done. So while in the short term, things may be slow when it comes to still the healthcare worker being burdened with this work, all of the groundwork that is happening, whether it be from the African CDC, whether it be from Smart Africa, whether it be DHIS2 or the HMISs, or creation of a health information exchange, or private sector companies like Capsule, we are putting all the work in place so that you no longer need to burden the healthcare worker to capture all of that data. So to the final part of your question, where it's on the future of data in Africa looking like, this is where I, as an innovator and as a optimist, naturally, you can't be an entrepreneur without being an optimist. I genuinely believe that Africa's future is a very interoperable, very easily utilizable future where data can be accessed, interpreted, and utilized to do what I mentioned earlier in my talk, have that feedback loop of taking the data that is monitored, providing some analytics on it so you can do some reporting and understanding, and using that to optimize the process to improve the system as a whole. And I believe that it's a matter of time before that future happens. It will take a mixture of institutions, private institutions like Capsule, or the funders like the Global Fund, or public institutions like the African CDC, or many of the other great institutions doing work in the space. But it will have to be a collective effort. But I think it will happen. It will happen sooner than we expect. And my hope is that within the next 10 years, we'll be looking to the rest of the world to show the world how a data exchange can work on a continent in not only a way that is able to capture the data, but is also in a way which is sustainable and has commercial interests, which doesn't exploit the actual patients which are generating the data. And that's what I believe. That's what I'm working towards every day. And I'm happy to pass to the other panelists if they want to chime in on that as well.
The data exists, but it's hidden away somewhere. Robert, do you agree?
Yeah, no, I would agree, and that we need to change. This is why, again, I'm very keen to start not looking at reporting solutions like we have with TB and HIV, as David was mentioning, and start to think from a patient perspective and think more about that longitudinal data. That really sort of brings this information together and allows it to be much more useful. And the open standards that that both David and also previously Jean-Philbert talked about, with things like the CPHIA. In fact, all of the speakers I think have touched on CPHIA. All of those things allow that information to exchange, and we will be able to bring that together. Are we doing it effectively and efficiently yet? No, I wouldn't say that we are, but it's there and we can. And I see a lot of positive drive in order to be able to do that. In fact, I was in the HALIDA conference a few weeks ago in Cape Town, which was very much focused on exactly this point. How do we bring this data together? How do we use these standards in the most effective way?
Yeah. Cyril, I see you on video. Do you want to come in?
Sure. First of all, I'd like to say that from Africa CDC's perspective, it's great to see this kind of energy from David. This is exactly what we want. And one element that we haven't really touched upon, I believe maybe Dr. Moon shared a few words about it, but it's the fact that we have 55 different countries. And although security and privacy are very important topics, we want to make sure that we move towards a single health data market. If we don't do that, how would you want a country such as Guinea-Bissau, 1.8 million people, to have startups flourishing and meeting their needs? So we need standards, yes, but we also need MOUs between countries, or maybe regulatory frameworks within regional economic communities to start with, and then for the full continent. This is the vision at Africa CDC.
Thank you, Cyril. Just to take a step back and introduce Cyril. Cyril Sek is a strategy advisor to the Africa CDC on digital health and digital transformation. I want to go back to Robert, because I've seen so many questions. I don't want to read them out loud, Robert, but I've seen quite a number of questions on CPHIA standards. And there's a particular question on the chat from Matt, who's saying, so there's so much focus on this standardization. How are we incentivizing people to use the standards? Why aren't people using the standards? Why aren't people standardizing? What's the missing piece? Robert, do you want to address that?
I think in terms of, I think there is a lot of incentive, or there's a lot of desire, I should say, in order to be able to use a standard. I think once people, the honest answer as to why are we not using them is just that they are still quite embryonic and being in their development. And as people start to see and understand the capability of the standard, they are being adopted much more rapidly. I'm seeing, like as I mentioned, I was at a conference just a couple of weeks ago to talk about the use of the standard and how it supports the protocols. The WHO only just coming out with their smart guidelines about how to pick up these standards and use them. They will be tremendously powerful. I think once you understand what they can do, I think you would be convinced yourself is the right way to go. Certainly, I have to say, from a global funds perspective, we are very much highlighting this as something that if you are looking for funding in the digital health space, these are the adopting these types of standards are the things that we expect to see, which adds a bit of an incentive there. But if we want to have the vision that Cyril was just talking about there, of having an African continent that has the ability to share data seamlessly across the 54 countries, then you need to be adopting these kind of standards. And ultimately, as people ask for them, developers will realize it's going to be very much almost a license to do business in this space. You will need to become more and more compliant. But it's new. I think is ultimately why do we not see it everywhere already?
I wonder whether it's a matter of legislating them, or is it a matter of market shaping, so that developers then know for them to work with any system, then they are left out if they don't use those standards. In the markets that you're working in digital health, do you see whether legislation, like regulation, like a stick, is what works, or it's more a matter of buy-in and
I think shaping? So what we're starting to see is, and one of the key documents that we always look for is the digital health strategy within a country, and from that digital health strategy, you then derive a blueprint of how do we see all of the different pieces of the jigsaw, how do we see them fitting together, and then you would get to the roadmap of delivery. But once you get to the point where you say, okay, these are all the different components that I need, it becomes almost it becomes obvious, or really quite compelling, that you need things like you need a health information exchange, and you need to have these interoperable standards. Because
yeah.
in many cases, I mean, we talk about an EMR, and you think about having one EMR in a country, but that's rarely the case.
Yeah.
When you look at you've got the public and the private health sectors. You could, if you wanted to, you could legislate the EMR to be used in the public space, not so in the private area, but you still want those two systems to be able to communicate with each other. And if you've got multiple labs, you've got multiple EMRs or community health systems, you want them all to talk together, you're going to need a standard. And this is a very powerful one that needs to be adopting. So whether or not you legislate or we are seeing it being articulated in those digital health strategies or the blueprints to say, this is the standard that we've chosen. And if you want to be able to plug in and communicate, then adopt the standard.
Yeah. Anne?
Yeah, thank you. I'd like also to add, I also saw there was a specific question to me and the Gravitate-Health ecosystem related to standards. And Gravitate-Health is committed to use and to drive development of advanced interoperability standards. We are currently, what should I say, in the recovery of COVID in Europe, the success of the COVID pass has inspired a lot of activity, and the politicians are currently discussing the European Health Data Space legislation, which is an attempt to make sure that as you cross border, drawing on the experiences of the COVID pass, but it's an attempt to take a subset of or key areas of information that is made available, and you can take it, you can have access to it cross border. Key elements of relevance to us is, of course, the e-prescription, e-dispensation, meaning that you have a prescription filed in the Norway, for example. We are affiliated with EU. You can have it dispensed in Spain, and then part of the epistemic justice or systemic justice is, of course, that since quite a few of us in Norway are not very proficient in Spanish, having the information about these medications in a language of choice, English or Norwegian in this specific, is an example. So we are, as I said, committed to advanced interoperability standards. We are working with the groups that are active on the European EHR exchange format. And I very much liked Mr. Davies' comment that Africa is leapfrogging and is leapfrogging in many areas. I think we see you jumped straight away to smartphones, for example. That's things that I have observed from work in Ethiopia. And I think that it might be interesting for you to look at some of the outcomes, processes and outcomes in that regard. A key issue for us in Gravitate-Health, and that has more or less led us to extensive use of FHIA interoperability resources, is also looking at what's happening around us. As I said, we have a subset of electronic health record information that we include in our match or in our focusing processes, and we are using the International Patient Summary and the International Patient Summary definitions to achieve that. There is an implementation guide, FHIA implementation guide for the International Patient Summary, which then comes in handy. We have been instrumental in creating the FHIA implementation guide for electronic product information also, and the choice of FHIA in that regard is in part influenced by the fact that the European Medicine Agency, in their effort and the head of medicine agencies in collaboration, have singled out FHIA as their resource. So it makes sense to work in a way that multiply those efforts. This is not to say that we are not interested in other interoperability standards, including IHE, but there is this thing about standards that are quite a few to choose in, and good governance in this field is important. Lastly, I would like to say there are different communities of public-private collaboration to advance these standards. There are, and one of the communities that has been quite important for us has been the HL7 CPHIA accelerators, where we meet 3 times a year, work in between, but come together to create interoperability resources at scale. This is a collective effort, and the outputs are publicly available, and it's driving towards the notion of global common good. So if you're interested in more information about that, we're happy to share out. But I think that would be my take. Some people also say that with the European Health Data Space, for the components that have been singled out as critically important for cross-border mobility, is an attempt to legislate interoperability. So you can pay a little bit attention to this. We expect the European Health Data Space to be concluded, or the legislation should pass in 24. It's somewhat delayed. That's also a common thing when you do initiatives at scale. There are many voices that comes into the process and also contribute to shape the processes. So again, good governance and a clear vision is important. Thank you.
Absolutely. And I think that answers Neil's question from Senegal. Nyawera, please come in. You can unmute yourself. We have a comment from a participant. You can unmute and speak and tell us where you're from.
Okay, thank you. Hi, everyone. My name is Nyawera. I'm a clinician in Nairobi, Kenya. And I just wanted to say thank you for allowing us to participate in this discussion and information sharing session. I just wanted to say something about what Anne said, Anne from Gravitate-Health, about using language that patients can understand, because I found it very powerful when whenever I deal with like public health, like let me say non-communicable diseases or chronic diseases for that matter, where patients need maybe reminders, to use like messaging applications in languages that patients can remember, can understand and articulate in. I find it very powerful for patients to be able to discuss and synthesize and then give you feedback as a clinician. So that's something that I have found useful, and I wanted to thank Anne for bringing up that aspect of local language use. Thank you.
Thank you, Nyawera. And I think that's the same sentiment that we've seen on the chat from several people who've asked questions about the power of collecting data in local languages. Thank you for that comment. Now, we have a question. I don't know if any of the panelists, wanted to speak. And you wanted to respond to that?
No, I just would like to comment to Nyawera. Apologies for my pronunciation. That I think that is one of the things that the access to information in a language of choice and in an understandable way. Some also like pictures rather than text or voice. Is a powerful strategy to engage the citizens. And I think that is an area where we will see a lot of advancement and opportunity going forward. But I also understand that there are limits to the DHIS that comes from another group at the University of Oslo has made important contribution, but I think, as Mr. Cryer points out, that more robust systems for the day-to-day care. Treatment is important, and also, but I think, and then resources for patients and the significant others should follow suit, because we do a lot of things in our everyday lives that comes back, and if we do it right, it comes back to the healthcare system. And if we do it right and do our share, the opportunities for good outcomes is, and maybe also less or other questions to the healthcare system, is an opportunity to, among other things, mitigate shortages. So there is an opportunity here to empower the users, add reminders, add communication, two-way communication. We will be doing that later on in the project, and to synthesize and make this information accessible for everyday use. I think that's would be my comment, and thank you for pointing this out, Nivara.
Yes. So I'd like to pose a question to Cyril about the role of Africa CDC in this standardization process. Where does the role of CDC begin and end? You know, because it's the member states that will roll out these policies and standards. But as you prepare that, I just want to pose to everybody on the panel that from what I'm seeing in the questions, it seems health workers sometimes there's a demand for more and more data as we're becoming more and more digital and more frenzied about this digital opportunity, that sometimes health workers just feel they don't understand what's being collected and for what reason. Robert, you mentioned that data, you know, defies gravity. It doesn't come back down to the patient. But I think the health workers on this call are saying it doesn't come back down to them either. They don't even understand all these tools that they have to use to collect data. Why? All they want to do is treat their patient. But the system managers are just demanding so much data. Are we not communicating to the health worker well, or are we not designing solutions with them in mind? So any of you can take that, and then I'll.
Thank you, Daniela. Yeah, thank you, Daniela. I'm not sure I'm taking the floor at the right moment. My connection is not so great, but I could see your face moving while not really clearly listening to you, hearing you. And I can see that those are big questions. So from
I can hear
but
you.
from I think I got it. Okay, great. So first of all, let me clarify one point. Africa CDC's role is to support member states when it comes to their national level. So ministries of health and national public health institutes were not really tasked to support anything that would be subnational, although we know that it's very often where the focus should be made, especially on primary healthcare, for instance. So we need to work with a series of partners, but first and foremost, the national authorities, whenever we want to strengthen health systems. So that's just to clarify the context and our role vis-a-vis the other parties and stakeholders in this field. Also, we're a very young organization, only 7. So we're gradually getting there. But when it comes to the revolution, and with all the various opportunities and leapfrogs that David and Anne mentioned, when it comes to those big changes, it is important to understand, and that's always one of the things that we say to our counterparts in member states, that digital approaches and tools are not about strengthening their systems as is. So if they have a pyramid with a breakdown of roles and responsibilities, new tools, new digital tools may completely change this. And that is a very complicated element to accept, and to, even if it's okay, to if it's understood, to actually implement. So we believe that change management is critical. and that even beyond the usual positions, clinical positions, there is a variety of non-clinical positions that should be created within HR plans within member states. And that's one of the areas. So our role basically is to support at the national level, to prepare, to envision, and to draft roadmaps that are relevant to the particular context. And yeah, Robert earlier said that having a digital strategy is an important point. Those digital strategies have to be it has to be easy to operationalize. So there is a lot of fine-tuning that is needed, and a lot of alignment of partners so that we can actually move the ball forward. Let me pause here.
Thank you. Thank you, Cyril. So back to the question on the health workers and them feeling overlooked by the system managers and the focus on patients, and they're in between. Robert, you want to comment?
Yeah, sorry. I have to say, I've seen it from both sides. If there's a requirement for the data to be collected, and it's seen as a burden, and we employ data entry clerks that transcribe things from a doctor's notes onto a laptop, and then the data disappears and they never see the results of that. There's very little reward in that process for the data, for putting the data in, and it's seen as a burden. It's something you have to do either legislatively or because it helps keep the funds running. I've seen that side of it, but then the other side, which I think is really powerful and inspiring. I saw it recently at a clinic in Zimbabwe, where they were testing out the Implio tool in various clinics, and the sister who was leading that clinic had her laptop. She had her data. She knew how many patients that they'd seen today, how many they'd seen this week, what were the trends, what was working well, what was not working so well, and she was empowered. This was her clinic. She wanted to see it run the best it could run, and we were putting data in her hands in order to be able to do that. And it really was transformational. If we can get that information back down into the hands of the people that are both the clinicians, so they have the best information to be able to treat the patient, but also, even just at the clinical level, to see it is worth putting this information in, it is worth capturing it, or even better still, the way in which we capture it, it is just part of the transactional process. It's not an overhead that needs to be done. The switch that you see in the way in which the information is perceived is really quite something, because everybody wants to do the best that they can. They want to do a good job, and they want to be very proud of their clinic and the way in which it works, and you're just giving them the tools in order to be able to do that. It's great if you can actually get the information where it can be really effective. And one of my feelings is that if you can empower individual clinics with all that information, you're going to do a lot more good if you sum up all of that than you possibly could do at a national level at looking at and grooming through all the data. Yes, you can make some strategic decisions, and you can have some quite important influences on what's going on, but really at the grassroots level, that's where the rubber hits the road.
Yeah.
Thanks.
Agreed. Now, panelists, data privacy and confidentiality. Mr. Ogada brings up a very good point here on the questions. And I think it's a good point for Africa, because a lot of our health system programs are run by foreign entities. We have a lot of development work in health, and sometimes, we're not sure where the data is going, where it's residing. What can you comment on how do we control and have sovereignty of our local data, maintain confidentiality, and feel that, you know, we're in control of our own data? What are your thoughts? I'll open it up to all of you.
Shall I come in again on
please.
this one? I don't want to dominate, but anyway.
Yes.
No, I think I very much understand and respect the need for sovereignty of the data. And if I wear my sort of my technical hat for a moment, one of the dilemmas that that we have is, if we want to deploy at scale and with flexibility and at speed, then the ability to use cloud services is a key enabler in doing that. Now, right now, most of the big cloud services or suppliers are coming from large American companies. You know, AWS, Google, Microsoft Azure are the sort of leading exponents of this, and that really does cause some nervousness around the guarding of the data. But and so one of the things that we often are looking for is, where are those cloud service providers in country, and what can we do, particularly in the private sector, to encourage the use of local data centers that offer cloud services, so you keep that national sovereignty of your data. And so it is a balancing out, and sometimes we see RFPs coming out saying no cloud services, and I think I understand it, but I think it's the wrong approach. You want national cloud services, and the capacity building that we need to do is actually from the ministries of ICT, particularly, and also the private sector. What can we do to encourage in-country data centers that can offer cloud services? And that's very much the way in which I would encourage people to go. That would be my thoughts on it. Thanks.
Yeah.
If I may, being the non-technical person on the call in the webinar, I know from collaboration and capacity exchange in between Norway and Ethiopia, which I have universities which I have participated in, that one of the things that was important to our Ethiopian partners were also to have full access to the code. So that you could do your changes locally, didn't have to go through intensive or labor-intensive and expensive processes. So I think the migration towards software, open source software, and software as a common good could be one additional thing to consider. And then lastly, also respecting people's choices for how much data they would enter, especially from the public perspective, how much of the health data you would allow different services to use is a huge debate, but it is also a right of many people to say, you can have these data, but you can't have those, in terms of value-adding services, like how we could position Gravitate-Health in that regard. So that's the reason also why we're working with small sets of private or personal health data from the get-go. If you see my point. So there are different things, but it is indeed a challenge, and I think we see that also in closer to home in Europe, where there are we need the cloud services, but we also need to make sure that we have the full sovereignty and governance of them.
Correct.
David, I think you wanted to go.
Go ahead,
Yeah.
Cyril.
I'll go later.
Thank you, Cyril. So yeah, just to add the perspective and color from an innovator's point of view, this is something that I've spoken at great lengths about to both government entities to some large consortiums of different organizations. And there are a few nuances that are specific to Africa, which mean that the feasibility of some of these ideals may not apply as well. And we need to actually be pragmatic around how we address those. So one of the major things that is referenced is the need for data to be hosted in country. And again, all of the major data providers are American companies. I guess the rest of the world is beholden to. I think one of the nuances about Europe, which doesn't apply on the continent, is that because of the frankly speaking, the economic value of the European business to these companies, they have created data centers in countries in all of the, or most, if not all, of the European countries. So they can actually comply with the need to host data in country, whereas practically speaking, across the African continent, there may not be any desire from the Googles, Amazons, and Microsofts of this world to start building data centers in Rwanda or in Zimbabwe or any of the other African countries. So what that creates is a technical limitation on the ability to use these cloud services. And yes, Rob made a brilliant point that the creation of local capacity when it comes to cloud computing is key, because a lot of the things that we want to do when it comes to interoperability or creating digital health systems requires cloud computing. But then there's another practical limitation where local providers simply cannot compete with the scale of the Googles, Microsofts, and Amazons, where you're looking at 100 to 1,000 times more expensive with none of the tools that Google, Amazon, or Microsoft are able to provide out of the box. So a consequence of that is that actual innovation on the continent will be stifled if the nationalism of or sovereignty of data is really pushed by the respective governments, because what that will mean is that you're effectively ruling out any of the innovators in your local country from using the tools that can create transformative healthcare technology. So what we believe and what we have suggested in the conversations that we have is really define the type of health data that can be exported and ones that can't be exported if in the case you need to use foreign controlled entities to do the processes. So for instance, one of the solutions that we came up with Capsule was to make sure that all data is anonymized, de-identified, and aggregated before it goes to any of the cloud services, so that no individual patient or no individual's information could be identified, so that we can still use the cloud computing to do all the computations, use their AI models out of the box, to use some of the brilliant tools that they've been able to democratize for innovators, while still being protective and cognizant of the potential risks. And I think just having frameworks like that, where practically this is how you get around the issues of data protection while still being able to utilize some of the tools that are available in the global market is key. And I think that a lot more communication should be happening. And this is something that I personally want to communicate loudly to the innovator community, that there are ways of using the tools that are available to build your businesses, to build your technologies, while still protecting personal data.
Thank you. Cyril?
Fully aligned with what David just shared. Last year, while we were crafting the digital transformation strategy at Africa CDC, we had numerous discussions and workshops with a number of representatives from member states. And this question of data localization was always a very heated discussion. And not everyone agrees. It wouldn't be fair to say that everyone wants to have their data within their borders. We've had discussions with Microsoft, with Google, and Amazon Web Services. And the current thinking at Africa CDC is that while developing national policies is the first step, so that because all African countries need a robust data protection system or regulations, that clarifies what data can leave the country and what data cannot. At least, this is a very basic element. We should have clear regulations. But then when it comes to cloud services, we think that it is possible to build hybrid cloud solutions, basically, to tailor the various services, tailor the service level agreements with cloud providers, so that they respect the data sovereignty levels that have been defined in the country, and that there is mutual respect for data governance laws. But fully agree that we have to work with them. There is no way out for now, but we want to make sure that we tailor our agreements with them while working on capacity building. And eventually, maybe at the regional economic centers level, we build strong infrastructure, African infrastructure.
Thank you for those thoughts on national sovereignty of data. Now, at the risk of running out of time, I must wear a patient's hat and bring in the issue of, okay, I understand nationalization of data, countries own their own data, that's fine. But me, the patient, I don't even want my government to use my data for anything. My data is mine as the patient. Now, is this thinking stifling rollout of this electronic health records at country level? Robert, I'd like to hear. Certainly in Kenya, I know when we were just about to roll out a unique identifier for each Kenyan, our data protection law prevented that from happening because the government at that time was not able to demonstrate that they're protecting our data now. Should the government own my data and use my data? And how does this play into innovation and rolling out digital health platforms, giant EHRs, that can help us make decisions? That'll be my last question, and then we'll go into parting shots.
Maybe I can start and say that it's a real pity that Phil Nsengimana is not with us, because he is a fervent advocate for personal-centered data within health. There are many ways that he usually builds the case for this, but I think the most fundamental argument is that there is more flexibility, there is more it is safer in many ways to design architecture around individuals than those large nodes that take years and millions to build. So I believe that is his position. As Africa CDC, we do not have an official position on that, because we work for member states and they may have different views on it.
Yeah. It's arguable what is a more ethical approach. And yeah, I think, we have to I think Africa CDC, you have your work cut out for you, because every country will have different rules. But certainly I think patients feel, I don't want the insurance company to use my data for anything. I don't want the hospital, I don't even want the doctor to use my data. My data is mine. I should flip on the switch or off the switch that allows you to even see my data and make a decision on it. David, you have your hand up.
Yes, thank you. I think that there's one more point that I'd like to add from an innovator's perspective, that I encounter this problem all the time. And what I've noticed when speaking with people who have concerns about data is that it's not necessarily the accessing or use of the data that they're worried about, it's the misuse of it and being used in ways that they don't understand. So I think when institutions that are requesting or collecting data are transparent on how the data is being used, what commercial interests they may have, if any, disclosing all of that information beforehand, as well as saying how the data will be utilized and destroyed once they get the answer to the questions that they're using. That is the major concern. And I think a lot of the work that needs to be done is more communication on educating patients, educating populations on, yes, this is your data, but this is how your data will help improve our country's health system. This is how this data can actually help resource allocation within the country. And this is how the data has commercial potential and how it's being utilized. And I think once the transparency is there, a lot of the concerns would alleviate. And an example that I always use when speaking to someone is, if I wouldn't feel concerned if someone knew that a 6'2" gentleman who's age 32 went to take some malaria treatment. Like for me personally, I wouldn't feel like that violates any information about me. And oftentimes that's the level of granularity that is needed to answer some of the pertinent questions on the health system. So that's my point. I see that Dr. Anne also wants to chime in, so I'll pass the mic.
Thank you. I actually wanted to chime in, and thank you for these considerations. I think misuse is you want to protect yourself against misuse and exploitation. Therefore, I think that what we're trying to do with Gravitate-Health, since we are a beneficiary, we are building on people wanting to use their personal health data, is to have explainability and also emphasize in a respectful way the benefits of sharing subsets of your data. Because it is sometimes, and allude to the point that if you share data from the past, you may have a more precise treatment going forward. So the benefit and the explainability of sharing data, but we also work from the perspective that it is up to the user to disclose how much they feel comfortable with. And from that perspective, it's also that premise, we are presenting ourselves as respectful of the people's choices.
Correct. Participants, we're talking about empowering patients through digital health information for public health in Africa. And I want to get a round of parting shots from our panelists, starting with you, Cyril. Cyril will speak for Jean-Philbert.
Yes, sure. So I'd like to say that Africa CDC is still very new in this topic. We drafted the first digital transformation strategy and released it earlier this year. It is a very crowded area, and we want to make sure that we position ourselves to make sure that the various stakeholders are well aligned and that we're contributing to this by providing experience sharing among countries, among stakeholders, and making sure that we are more united. This is our mission.
Thank you, Cyril. And if it's shareable, feel free to share with all our participants the Africa CDC digital transformation strategy.
Sure.
Rob,
put it in the chat box.
Yeah, thank you.
Hi, yeah, thanks. From the Global Fund's perspective, I think there's becoming an ever-increasing realization of the power of digital health. In fact, the Country Technical Services, which I lead, is still a relatively new team that's been created at the Global Fund, recognizing the growth in digital health. And I think not just the Global Fund, but I think in general, I think there's a huge potential here to do something really good with digital, and where we can support it, where we can fund it, then that's what we do. I'm very optimistic about the benefits that are to come with digital health. Thanks.
Thank you. David?
Yeah, so I'll have to echo Rob's optimism on where we're going with digital health. And I think even AHB setting up this forum is a prime example of how we're going far by going together, because this is pulling together perspectives from the private sector, public sector, academia, and also from donors. And it's the collaboration amongst all of these institutions and sharing of learnings and experiences that I think really does give Africa a unique opportunity to leapfrog and really drive systemic healthcare change and improvement for years to come. So my parting thoughts is that there will be and there will continue to be a lot of work to be done, but fortunately we have many committed people from all sides of the spectrum and all sides of the table, and we're actively working together to drive it forward. So I'm full of optimism. Thank you.
Thank you. Anne, please close it for us.
Thank you, and thank you for this important question. We share the optimism. Access to relevant information from trusted sources, that's understandable, is an important key area. It's an important contributor to make sure and stimulate that in the everyday life and in the care between care, as well as during active treatment, we know what to do. And I also very much align with the notion of going together. That's where how we can make good progress. And we should, as we go together, make sure that we are leaving as few as possible behind us. That we need a collective effort, and we need to have as many as possible systematically joining our effort. And I think that will be the key to success, that we're not opening a digital divide, but that we're actually actively contributing to close it.
Absolutely. The Africa CDC on the panel telling us that they have an Africa Digital Health Network as part of their digital health, digital transformation strategy. And that strategy is on the chat for everybody to see. Rob from the Global Fund gave us, amongst other thoughts that he shared, he talks about the value of global goods, and he introduced the idea that we want data to actually be subject to gravity and float back down to the patients and even the health workers, so that we complete feedback loop. David from Capsule, it's good to see that you're optimistic that innovation will make a difference in Africa in terms of monitoring, reporting, and optimization of health data. And Anne, we're so thankful for you sharing a practical example through the Gravitate-Health project, how data can be used to empower patients in different languages with different levels of ability or disability. I've been so proud and honored to listen to you panelists. Let's give a hand of applause to them. You can use the emoji in the chat function to just appreciate our panelists. This brings us to the end of our webinar. I hand the meeting back to Edwin to give us a few announcements. Thank you.
Okay, thank you, Dr. Daniela and our panelists, and greeting once more to our participants. I believe we have all achieved our goal set for this session. Maybe just a remark and a parting shot also from my end. Together, as we embrace digital health information, it's not just a technological gap, but it's also a transformational journey towards accessing patient-centered care. Thank you. Now, as we conclude the session, I'd like to highlight just some few key announcements. The first one I can say it's the session feedback. Please feel free to scan the QR code for the session feedback. We'd really love to hear your thoughts on today's sessions. Your insights are very crucial and will help us improve to make our sessions better. These links are also being shared on the chat box. Thank you. On to the next one. We have our first, there's the first Gravitate-Health hackathon themed design patient information for the future. This is set for January 17th to 19th for next year. This exciting event is held in a hybrid format and allow you to participate either on-site in Greece or virtually. Participation is, of course, free of charge, and although you're required to book in advance. Just visit the website link for more information, such as which challenges will be shared and the procedures, etc. Yeah, thank you. The next one, we have 4 more HB sessions within CPHIA 2023. These are scheduled for 23, 24th, and 27th of November 2023. Our first one is called the Enhancing Africa's Health Security System, themed blood as a cornerstone for pandemic preparedness. So if you're interested in knowing more about blood and its pandemic preparedness, please feel free to visit the link. Our next one is another session on COHA. It will now bring the role of the private sector in advancing women's health in Africa. This is organized by the Coalition of Women's Health Africa. If you're still interested in advancing women's health, please feel free to join. This one is scheduled for 24th of November. And our final session is in Lusaka, organized by HB in collaboration with Pfizer, themed action-oriented respective partnerships for the public health in Africa. If in Lusaka, this is a really good opportunity for you to meet us in person and also communicate more. Our next session will also be in Lusaka, here on 29th November. This one is now accelerating the universal healthcare coverage by leveraging private sector. This is also a really, really nice session if you're in Lusaka to attend. Now, finally, now the main reason why we have this session is now the CPHIA 2023. This will be the main event where all roads for healthcare will meet. It's set for 27th to 30th of November at the Mulungushi International Conference Center in Zambia, Lusaka. If you'll still be there, we can connect furthermore and continue discussing more about the digital health information in Africa. And finally, we have HB Symposium 2024. HB is organizing the second symposium with the theme, A New Dawn of Partnerships for Africa Women's Health. This will specifically promote and advance women's health in Africa. It's actually like a follow-up to the session that we'll have in Lusaka next week, but feel free to join us in 23rd May of 2024. Feel free to visit our website placed on the link on the chat box. Okay, that's all from my side. A vote of thanks to our esteemed panelists and to you, our participants. We really appreciate it for being part of this virtual session today and wishing you a very restful day ahead. Thank you. This is Edwin signing out. Good.
Have a good day. Thank you so much, everyone.
Thank you.